Okay, let's dive into this. Imagine you're a teenager and you're facing this massive, life-changing surgery to prevent a cancer you don't even have yet. Today, we're going to look at a really surprising discovery that's shaking up how we think about a high-stakes genetic condition and what it all means for the young people living with it.
It really all comes down to this one simple but super powerful question. What happens when the official playbook, the one all the experts have agreed on, just doesn't match what's actually happening in hospitals across the country?
So, to really get why this is such a big deal, we need to get on the same page about the condition at the heart of this whole story. It's just a three-letter acronym, but it has lifelong implications. FAP. So, FAP, that stands for Familial Adenomatous Polyposis, is a genetic condition. Basically, it causes your body to grow hundreds, sometimes literally thousands, of polyps in your colon and rectum. And the really key part? This whole process often kicks off when a person is just a teenager. And here's the unavoidable truth of it. If FAP is just left untreated, the question isn't if those polyps will become cancerous, it's when. And the median age for that to happen is just 39 years old. So this isn't a game of chance, it's pretty much a certainty. Right. So with a risk that high, you obviously can't just wait around and see what happens. The medical community has a really clear, proactive strategy. It's like a roadmap designed to get way ahead of the disease before it can even really start. And that roadmap leads to a major surgery called a prophylactic colectomy. Okay, that's a mouthful. Let's break it down. Prophylactic just means preventative, and colectomy is the removal of the colon. The whole goal is to take out the organ before cancer ever has a chance to develop. And for years, the guidelines have all suggested that the best time for this is in a patient's late teens or early 20s. But, and this is where the story gets really interesting, a huge study looking at data from 46 different children's hospitals in the US over an 11-year period found something that, well, it just didn't quite line up with that timeline. Okay, so take a look at this chart. This is the real-world data we're talking about. Each one of those bars is an age, and how tall it is tells you how many surgeries happened at that age. You can see it right away. The peak, the big spike, it's not in the late teens or early 20s like the guidelines say. It's happening way earlier. In fact, the median age for this surgery across all these hundreds of patients wasn't 19 or 20. It was just 14 years old. That's a full 5 to 6 years earlier than what the guidelines have been suggesting. And this is the million-dollar question the researchers really wanted to answer. What's going on here? Is this a problem? Or is this early surgery actually telling us something totally new about the disease itself? What is driving this trend? To get some answers, the researchers had to put on their detective hats and dig a lot deeper. They didn't just look at when the surgeries were happening, but also what kind of surgeries were actually being done. And a huge clue jumped right out of the data on surgical procedures. You see that big orange slice of the chart? The vast majority of patients, we're talking 62%, were getting a more extensive procedure known as an IPAA. Meanwhile, only a tiny fraction had a different surgery called an IRA. And here's why that difference is so important. The less common surgery, the IIA, takes out the colon, but it leaves the rectum. The far more common one, the IPAA, takes out both the colon and the rectum. It's usually the one surgeons choose for patients who have more severe disease, especially if there are a lot of polyps in the rectum. So, this suggests that these younger patients might actually have a more aggressive form of FAP that needs an earlier, more extensive surgery. But the investigation didn't stop there. The data also uncovered a second puzzle, and this one has huge implications for a patient's entire lifelong journey with FAP. So check these out. These charts reveal something really surprising about what happens before and after the big surgery. They show the number of follow-up procedures, called endoscopies, that patients had at the very same hospital where they had their surgery. You see those huge black sections that say none? Well, they tell a really powerful story. I mean, the numbers are pretty stark. 60% of patients had no record of any pre-surgery checkups at the hospital, and a whopping 78% had no post-surgery follow-ups there either. Now, this doesn't mean they weren't getting any care at all, but it strongly suggests their care was fragmented, happening in different places, and that raises some really big questions about coordination and the need for a consistent medical home. So what do we do with all this new information?
This isn't about finding fault or pointing fingers. It's about getting a much clearer picture of what's really going on. It's about using this real-world data to build a better, stronger bridge for patients and their families as they navigate this journey.
By understanding that so many young patients might need surgery earlier and that their care is often split up between different places, we can actually start to build better systems. This means creating stronger support networks, improving how doctors and specialists coordinate, and maybe most importantly, planning for a really smooth transition from pediatric to adult care, because this is a lifelong condition. And, the study's authors really said it perfectly. This is all about setting the right expectations for the long haul. It's about empowering families with a really clear picture of the road ahead and making sure they're prepared for a lifetime of care that's proactive, coordinated, and ultimately successful. And that brings us to the most important question of all, the one this research is really asking us to think about. For every family that's navigating this diagnosis, and for all the medical teams that support them, the challenge is clear. How can we use everything we've just learned to build a truly seamless, supportive bridge that leads to a long, healthy future?